2020 has been a tough year. The COVID-19 pandemic played significantly along the economic differences, impacting access to health, livelihoods, safety, and sanitation, most severely impacting the urban poor.
The COVID-19 crisis and, of course, the lockdown in particular has made the invisible problem of the urban poor and migrant workers visible to the state, to the industry, and to the public at large.
The current pandemic, more than anything, has shown us very clearly the power of grassroots community groups and their own ability to mobilize and play a strong role in strengthening the response for their members.
In the midst of this pandemic, the NFSSM Alliance came together stronger than ever before. Despite the challenges, we worked collaboratively and supported each other to build back better by shedding light on sanitation challenges that the most vulnerable sections of the society face daily.
In one of the encouraging developments, recently the Panchayati Raj Department has announced involvement of SHG members in management of community toilets.
जब हम sanitation work में जाते हैं तो सोसाइटी में एक थॉट्स रहता है कि ये काम सुनने में थोड़ा अलग फील का साउंड्स होता है। फिर धीरे धीरे जब स्वच्छ भारत मिशन के अंदर हम लोगों को अवेयरनेस कैंपेन वगैरह किया गया तो हमारी ग्रुप्स को समझ में आया कि हम जो कचरा खुद फैला रहे हैं उसको क्लीन करने के काम खुद करें तो इसमें कोई दिक्कत नहीं है।
Capacity building of the self-help group is very important, which we do it as a kind of as a routine regular one, and we develop the business models for them, standard operating procedures, the templates, guidelines, protocols.
Joining forces to build capacities of communities, ensuring employment and dignity of work.
That we have added almost 9 crore toilets. These toilets have to be periodically desludged, periodically transported and safely managed. Hence, this conversation of minimizing the risk, eliminating the risk, minimizing mortality and morbidity is super important for our country at this point in time.
We have also prepared lots of resource material, capacity building workshop for the sanitation worker, and also we have, in consultation with the SMMU, we have also prepared a CSR proposal to protect the sanitation workers.
The biggest learning for us has been just giving these community teams, which are kind of in some shape or form working informally in slums and urban low-income settlements, formalizing them and giving them recognition with the local authorities.
Prioritizing municipal reforms to build resilient cities that can withstand the detrimental effects of such disasters.
We need to specify fiscal tools in the Constitution. We want the Central Finance Commission to recognize that there has to be more untied grants available.
Inspiring innovations in protective equipment for frontline workers and technologies that allow safe sanitation service provision.
We are rolling out a comprehensive model for occupational safety in Trichy, which is not just PPE but looking at protocols, looking at communications with sanitation workers. We will take it to the state government. We are keeping the state government in the loop on how we are implementing it.
Now we are actually exploring at the state level that who are the PPE suppliers, how do we ensure that the PPE supply chain links with local governments can actually take place.
Engaging with over 15 government officials and departments across more than 40 discussion forums, recommendation documents and information packs, the National Fecal Sludge and Septage Management Alliance persisted and pivoted to adapt to these everyday changes.
As sanitation practitioners and people believing in the value of sanitation, we actually have an opportunity to show the way to many other sectors who are trying to figure out ways to do the same things.
As we end this eventful year with some major highs and a few lows, we look forward to building back better as we continue to champion the cause for safe, inclusive and equitable sanitation services for the most vulnerable in 2021 and beyond.